Welcome to episode 4 of my back masterclass. We're gonna learn the complete framework on how to engage your deep core, back, and postural muscles safely and effectively. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. And in this video, I'll be demonstrating some key components as a framework, a blueprint of my core back immersion where I utilize Pilates, yoga, and physical therapy fused together to start regaining your life without back pain, to have a stronger core and improve overall posture. If you missed my first 3 videos, I recommend that you go back to episode 1 where I start showing you how to do proper breath work and neutral spine, and episode 2 where we utilize the foam roller and how to improve your postural awareness to activate those slow twitch muscle fibers, and episode 3 where I showed you some simple solutions, best kept secrets that I've been revealing in my channel and inside my back masterclass. And in this video, I'll be demonstrating how to use the elastic band, the foam roller, and the ball for absolute beginners, and also how to use the wall together with Pilates, yoga, and physical therapy to help support your weak, deep core muscles if you're suffering from different complications from back pain, sciatica, hip pain, hip injuries, postpartum complications. So let's begin the program now. We're going to start lying on your back with the foam roller on your pelvis, and the elastic band will be around your thighs. I'll be showing also the PNF patterns that you can start activating, especially on your thoracic spine. So as you slowly roll down on your back, inhale, exhale. You want to make sure you learn the proper breath work in episode 1. As you breathe in, you want to make sure you expand on your ribcage laterally and not thoracic breathing. You want to make sure when you inhale, you're not lifting your chest up, but rather opening to the side. All at the same time, you're going to feel your abdominal muscles rising because your diaphragm is resting down to help expand your lungs. And then as you breathe out, you want to zip it up from your lower abs all the way to your navel. It's like zipping up a tight jean instead of pushing down towards your pelvic floor. So most people with back pain, they start breathing through their chest, causing neck pain. And then as they exhale, they don't know how to breathe out safely through their mouth. And then they're pushing from the upper abs down to the pelvic floor. So it's a downward pressure. We want an upward zipping up. Again, inhale, expand, and then zip it up. 2 more, breathe in, and then breathe out. Last one, inhale, and exhale. Now we're going to place the foam roller on your pelvis. If this is a lot of pain, my recommendation is to start with a rolled towel, because most patients with SI joint dysfunction, they can't tolerate the pressure on your glutes because you're very weak in the condition. If you've been sitting a lot, you can create this dead butt syndrome. And then having a foam roller actually, or a rolled towel, or a small Pilates ball to support your pelvis, this helps elevate your weak pelvic floor. Men and women suffer from weakness over here because of a lot of sedentary lifestyle or injuries that happen with back pain injuries. So when you elevate, this helps activate your weak hip flexors that's usually tight, and it's not just weak, it's also tight. So with this and lower ab weakness, this helps you're already in an advantage against gravity. Because you're a little bit tilted, this helps you lift your knee to 90 degrees. So the elastic band gives you resistance as you breathe out, toes pointing away. And then if this is too challenging and you feel like the foam roller is rolling off, you can hold on to the foam roller. As you inhale, expand, exhale, lift. Alternating left and right. I like it to be balanced, switching left and right, so you can feel one side is weaker than the other. And it's also a mirror effect where the weaker side learns from the good side. With one side weakness and hip weakness, you need that support by utilizing your good side of your body. Again, inhale, expand your ribcage laterally, and then zip it up as you lift your leg to 90 degrees. Breathe out. Inhale, exhale. Last set. Well done. Now, after doing the tabletop position, now you can slowly extend your leg. So after tabletop, as you exhale, inhale, extend. If you can lock your knee yet because of stiffness, tightness, sciatica, or whatever the condition. Most patients with back pain, they're very stiff all the way to their toes, calf, and hamstrings. And if you can't lock, it's okay to slightly bend your knee, slow and steady to progress. You can't force yourself to lengthen in one day. You have to be patient, as consistency is key. So before, I can't even lock my knee like this. I'm usually like this. This was many years ago when I became certified with Pilates. It took me a lot of 4,000 hours to gain that flexibility. More than a year. Not kidding. Because I used to suffer from a lot of stiffness, pain, aches, even though I was young. But because of injury, it created to this nervous system of firing from our brain to stop you from moving your legs. So it's a lot of mind-body awareness. So exhale to tabletop. Inhale again. Exhale, extend as much as you can, toes pointing to the heavens. And then dorsiflex, which means point your toes towards you to feel a deeper stretch as you breathe out. And then inhale, keep that dorsiflex. So you're doing a little bit sciatic flossing for your nerve that's inflamed. Or if you don't have inflammation, it's still healthy for us to floss our sciatic nerve to tabletop to 90. And then inhale all the way down. And then switch to the other side. Tabletop as you breathe out. Inhale, extend, toes pointing away. And then dorsiflex, toes pointing you. And then exhale, slowly bend your knee to tabletop while keeping those toes in dorsiflex. And then all the way down. Alternating left and right. Tabletop, extend, dorsiflex your ankle, tabletop in dorsiflex, and then all the way down. 2 more. If the elastic band is rolling down, that's fine. The purpose of the band is to strengthen, at the same time help mind-body awareness where to stop and to give you guidance. It's a lot of mind-body awareness, low controlled. We're not plopping your feet and your legs. It's about mindfulness. And in the beginning, you might be a little bit off with your movement. And it's like a dance move. It takes a lot of repetitions to get better. Last set, my friends. Inhale, exhale, inhale, exhale, extend, inhale, exhale, dorsiflex, exhale, bend, and all the way down. Last set on your right. Well done. So those are one of the key components where I use the foam roller on my pelvis. For absolute beginners, I'm not forcing it too long. You have to slowly progress. And I also use the foam roller for stability, to engage your weak core. And the foam roller, because of a wrist, you might having wrist stiffness and pain, is a gentle pressure instead of the floor where it's too flat to 90 degrees on your wrist. This is something that you can almost like you're cupping your hands on something a little bit easier for your fingers. And one of my favorite exercises is prayer plank. Grab your toes on the mat. So grab your mat with your toes really tight. As you inhale, with your hands level to your shoulders, knees level to your hips, slowly lift off a few inches off the mat and breathe out. And then slowly lower down. Even just one breath for absolute beginner. Inhale, exhale, lift. And down. Last set, breathe in, breathe out. And then gently, I'm going to lower my hips down with back pain. Usually they're compressed on the lumbar spine. When you sit down on your heels, it helps open your hips. If you can't sit down all the way down, you can use pillows on your buttocks for support. And then slowly, child pose. Push the foam roller out gently as you slowly lower your head down to the mat. And then stretching your upper back and shoulders and breathe out. Hold this in 3 deep breaths. And then slowly kneel up. And after doing just gentle child pose, usually I recommend that up to 3 to 5 repetitions. If you have scoliosis, dextroscoliosis is when your curvature is to the right. I love to open your concave left side. So you're going to place the foam roller diagonally towards the right, and you're going to do a gentle opening on your left by reaching over your right and breathe out. And then slowly roll up to 3 deep breaths, and do that up to 3 to 5 reps. And if your level scoliosis, which is the curvature towards the left, then your concave side is on your right, and then roll the foam roller to the left. And there's more cases of dextroscoliosis because of your right hand dominance. There's a lot of rotations towards the left, and that's where the curvature starts forming to the right. And that's where I will discuss inside the back masterclass page. If you have scoliosis and if you want to join my upcoming reopening of my back masterclass. The next one is the physio ball. I would love you to learn how to use the ball because the ball is very gentle. At the same time, it helps stabilize, engage your core, all at the same time without any high impact. And then it helps really activate those weak, deep muscles. And my recommendation to make sure when you have a ball, it's not too big or not too small. You know the right size when you can go on your stomach and you can reach down to the floor with your knees leveled, hips leveled. And this is great for those with back pain because you need something to support. Most of my back pain cases, they can't place their hands down without the ball because they're very weak on their upper back and their scapular muscles. So this is a great way when you do bird dog. As you reach with one hand and extend one leg, you're not twisting your spine. You're keeping that core stable as you breathe out. Inhale as you go down, exhale as you reach. 2 more. Breathe in as you go down, exhale as you reach. Last set. And my recommendation is 10 repetitions each side of your upper body and lower body. And as I said, inside my back masterclass is an 8-week program. We're going to slowly build it up. This is just one of the frameworks I'm showing you in my short clip video because it's hard to capture everything in one video. And after doing that, I also show a lot of techniques using the ball to extend and use the upper back muscles with the ball. So when you're kneeling and your upper back, you can do some W's. W's is when you lift your elbows up, chin tuck, help your neck pain and upper back pain, scapular pain. And then elbows down to the ball as you breathe out. Open and close. Last set. And down. I also use the ball in side lying position. This helps your obliques, your scapular muscles. So with your hands up, and I do clamshell. So feet together, just lift the top knee, keeping the ball stable, hand planted down, and the ball is a beautiful support. I love this support for your weak obliques and shoulder and hand. Most patients, they can't do side plank, even on their elbows, even on their hands, because it's a lot of weakness and pain. And this is a great starting point as a framework where you can lift and then down, lift your knee and your hand to engage in one beautiful plane of motion. Last set. And my recommendation is to do it 10 repetitions each side, and the other side where you are weaker, do an extra set to help open up that tight, weak area in the gentle movement patterns. The next one, I'll show you how to use the wall. So the wall is a great way as a proprioceptive feedback. So as you lean on the wall, sitting, you can start sitting position with your knees bent because most back pain patients, they can't extend their leg. They'll be like this because they're so tight on the hamstrings and calves. Slightly bend your knees. And you don't have to touch your buttocks on the wall. You can be a few inches off. Palms up, hands out open, and slowly lift your hands up to a wall angel, touching your elbow and your hands all at the same time. And then slowly lower your elbows down to a W position and breathe out. Inhale, extend. Exhale all the way down to the side and breathe out. Again, from the starting position, palms out, back of your hand touching the wall. Inhale, exhale, lift. And then slowly bend your elbows. And then reach up before going back to the starting point. I'll also demonstrate some lovely rotation for your thoracic spine. Twist, reach, side to side as you breathe out and reach. So the wall gives you a nice feedback to keep your neck, upper back aligned and give you a lovely strengthening program for absolute beginners. So most of you guys might be having difficulty It takes time and repetitions, and that's why I'm here to guide you. And then I'll show you how to do it with your legs up on the wall. Let me place this angle so you can see how to lift your legs up with your feet up and the elastic band around your thighs, with the hips a few inches off the wall. So I said earlier, if you're absolute beginners, you can keep your knees bent first and then gently extend left and right to slowly lengthen and stretch. As you inhale, exhale, extend and breathe out. Feels so good on your hips and your hamstrings all the way to your calf. After doing 10 repetitions to warm up near the wall, as I said, you don't have to touch your buttocks on the wall for absolute beginners. Then you can do double knee bends and then extend, bend, extend. You can challenge by lifting your hands up and then hold that position so you can engage your core more. And if this is too challenging, you can place your hands on your side and slide. And then you can do beautiful butterfly stretch with the bands around your knees bent slowly. With your hands up, open your hands out and your knees out open as you breathe out. Inhale, center, exhale out. 2 more. Don't forget to zipping it up and proper breath work. Last set. And that helps your glutes muscles. One of my beautiful frameworks is to activate those deep hip external rotators. Now with your legs extended, toes pointing to the heavens, hands pointing up to the ceiling as well. Inhale, we're going to do one-sided V-stretch. Lower your foot down and your hand down to the side, keeping the other foot pointing to the heavens. Open that hip groin area. Most patients with hip groin pain, they're very tight, they can't lower it down. And it's okay to have it a little bit higher. And then alternating left and right, as I said earlier. Two more to go. Breathe in and breathe out as you open. And then inhale, exhale, lift up again. Last set. And the band will help you gently activate your hip muscles. The last exercise on the wall that I'm going to demonstrate today as one of my framework is a V-stretch. I love this stretch as you open your knees out and hips out and palms out open to help open those tightness. If you have trauma, you have some stiffness, aches and pain, it's good to release it and open it up as you breathe out, and then inhale back center. Open and then close. 2 more. Last set. And that's it. Those are some of my framework of my core back immersion where I utilize Pilates, yoga, and physical therapy. As I said, watch my episode 1, 2, and 3 before proceeding on this program because you don't want to miss out on my lovely videos. If you want to learn more about my back masterclass, I'll be reopening it on March 1st. Click the link on the description below. Be part of my early bird waitlist for a first come first serve basis because I like it small, intimate, and I want to make sure I could reach all your back pain goals so we can have Zoom calls and discuss what are your goals, what you need me to help you figuring out what's the root of your back pain, hip pain, neck pain problem, whatever you need to regain life without back pain, to have a stronger core and improve overall posture. If you have time today, watch episode 1 first, as I said, if you missed this out, or if you want to keep practicing the proper breath work. Watch this video and episode 2 over here on how to engage your deep core muscles. I'll see you in my next video training, episode 5. Don't miss out, where I'm going to share my lovely students who graduated recently, who finally regained their life without back pain, to have a stronger core and improve overall posture. I'll see you in my next video training. Always remember, be safe, be well, healthy you. Bye!